My wife retired in 2004 with a disability. Her school district helps pay for our health care. It has gone up every year, double digits. We are paying this year $13,500 for health care. My retirement basically goes for health care. I have to substitute to keep us above water.
In 2006, I lost my job, and I have not been able to find a job that's full-time with benefits. I have no medical benefits. I paid $13,000 to $15,000 in COBRA payments, so for my children and myself to keep the COBRA for 18 months. I lost my entire savings.
Personally, I have not used any health insurance for myself or my children or my family in the last 3.5 years because our deductible is so high, it was the only plan we could afford. And so the $12,000 that I have spent, that I spend on an annual basis for health care for myself and my children, I get no benefit for whatsoever.
My mother had a stroke in May. We paid $9,700 a month for her to live in a nursing home. No one pays for a nursing home, and no one pays for care in the home.
Question number 2, how do you choose a doctor or hospital? I look at the cost. I have no idea if the doctor or hospital is good or not. I look at, can I afford it?
There are no neurologists who are Parkinson's specialists between the Oregon border and the Golden Gate. You have to go east to Sacramento-Davis area or south to the city, Stanford, or the Parkinson's Institute in Sunnyvale in order to get specialist care for Parkinson's.
What I have is a family where kids are getting up into, say, 23, and that's another break point where you're no longer on your parents' plan. You got to have a job at that point that pays for your benefit, or you have to pay it yourself. I see that as a huge issue. Those people are vulnerable, as well as the folks that lose their jobs and the folks on fixed income. So there's got to be some solutions here. And
if it's not out of order, I'm going to cut to the chase and tell you what we ought to do. And that's single payer. There you go.
Number 4, which has to do with improve the employer strength. I think that to do that is a step backwards. I've been a strong proponent of Obama. By the way, I'm Gary Johansson. I've been a physician in town for 33 years, and I do end-of-life care. But I think that I know that Obama wants to start to walk before he runs. It takes small steps. Perhaps that's necessary to some degree, but to strengthen the employer base is going to be a step in the wrong direction. It will strengthen insurance companies' foothold on this multifactorial, multi-insurance company dilemma we have. And insurance companies do not have the public health at their heart.
And the fact of the matter is that we have a donut hole in Medicare Part D that ought to be renamed JAWS. It should be eliminated as one of the first acts of the redesign of the system.
With all of the intelligent comments made across the broad spectrum tonight, if President-elect Obama's team would like to implement pilot programs for integrated systems of wellness in perhaps 10 communities throughout the country, I hope that Petaluma can be considered for that, and I certainly would like to participate in that.
I am a proponent of single payer because our system, as we all know, is broken now. But we need to change the paradigm of the way medicine is delivered. And that means looking at things in more of a preventative way. You give incentives for people who live a healthy life.
We need to look at the other countries that have systems and look and see what they're doing and take the best practices from each of those countries and put them together and make it our own.
Right now we have a disease treatment industry, and what we need is a healthcare system. And Kaiser has been mentioned several times. VA is another system that is a model that can be looked at.
We think that one of the critical things in the development of a national healthcare system is something which seeks to integrate the top-down design issues with the bottom-up grassroots things that are going on already in this county and probably every other county in the country There are heroes and heroines all around this country making service possible. And so there ought to be an integration that takes consideration for who's already doing the work. And that optimizes the chance that we're going to have a really effective plan.
The reason that we won this election is because we organized like this. We got together and we worked really, really hard as a unit to elect that man and get him into the White House so that he could do this kind of work for us. When we walk out of here, if we don't follow up on this and stay organized and write our representatives and tell them over and over and over again what we want to happen, it's not going to happen, because you can bet that the insurance industry and Big Pharma are sitting down right now. They're going to watch every single YouTube video of all of us talking about this, and they're going to come up with a plan that they're going to present to our representatives about how they're going to take care of us. So I want to encourage everybody, if you have another meeting, I want everybody to come, bring people from your block, and we need to stay organized and keep this discussion going. Write your representatives, please.